Hello, and good morning, Sammamish. Thank you for joining us on Channel 7 News. I'm your host, Adam Beatty.
And I'm your co-host, Jimmy Butler. Tonight, we'll be discussing the rise and effects of mad cow disease. Our science reporter, Harrison Cade, is at the Rouge farm, where they work to ensure their cows are not infected with this terrible disease. Harrison?
Thank you, Jimmy. I'm here at the Rouge family farm. They work diligently to ensure that the meat they produce is safe. Safe from what? Mad cow disease. What is mad cow disease and where did it start? Mad cow disease was discovered in when cows consumed meat infected with scrapie in British herds in the 1980s. They caused an outbreak of mad cow disease among cows in Britain. Some humans then ate parts of either the brain or the spinal cord in the infected cow. The consumption of infected cow meat leads to the development of Creutzfeldt-Jakob disease. Fortunately, the cows at Rouge family farms are well taken care of and free from disease. There's no story here, so I'll send it back to you in the studio.
Thanks, Harrison. Good to know that we're safe if we eat beef from the Rouge farm. However, that isn't true of all meat. Before the FDA started testing meat for the disease, some people developed Creutzfeldt-Jacobs disease from eating infected meat. Creutzfeldt-Jacobs disease is a 100% fatal brain disease. The average life expectancy is 13 months. As of now, Creutzfeldt-Jacobs disease has claimed 220 lives. People can contract the disease by coming in contact with infected skin or brain matter, or by eating infected cow meat. Tissues like the brain, spinal cord, retina, optic nerve, and dorsal root can be infected very easily by the disease.
In humans, it only affects the PRNP protein, which is subverted in the prion disease. This can occur in either methionine or valine at amino acid 129. At a cellular level, the disease causes healthy proteins to misfold and cause havoc. These misfolded proteins are called prions. Creutzfeldt-Jakob disease is caused when an unhealthy misfolded protein enters the brain or the spinal cord and causes other healthy proteins to misfold. This wreaks havoc in the brain and spinal cord. Once a prion enters the system, your immune system cannot stop it. Because of the unhealthy prions, the brain cannot communicate with the rest of the body, causing all of the symptoms.
Some of the symptoms include, but are not limited to, sponge-like lesions in the brain, memory problems, behavioral changes, poor coordination, dementia, involuntary movements, blindness, weakness, coma, and psychiatric problems. The only way to diagnose Creutzfeldt-Jacobs disease is to sample the brain matter of the patient. No other tests work. Some symptoms that are telltale signs of Creutzfeldt-Jacobs disease include dementia, involuntary movements, and stroke-like symptoms. Both mad cow disease and Creutzfeldt-Jacobs disease develop in the brain and spinal cord.
This disease does not eat anything, but in sections of tissue where the disease has taken hold, sponge-like architecture is formed. This spongy tissue deteriorates the organ it is found in. In Creutzfeldt-Jacobs disease case, it deteriorates the brain and the spinal cord.
Thankfully, the disease does not release a toxin into the host, Its destructive capabilities are limited to the conversion of healthy cells to unhealthy cells.
The cell damage caused by the Creutzfeldt-Jacobs disease is immense. Inside the body, the prions create holes in the brain cells. Inside of the cells, the prions cause the proteins to misfold.
Inside the host, proteins are the main target of the attack. Because of the amount of proteins inside the body, the attack increases exponentially. This is because once a healthy protein changes to a prion, it proceeds to infect more proteins, and this vicious cycle continues until the host is dead.
The reason this disease is 100% fatal is because of the immune system's role in the fight. The immune system is unable to distinguish the difference between a healthy working protein or an unhealthy misfolded prion. Because of this, the disease cannot be cured by any normal scientific methods.
Like I stated earlier, this disease started when a cow ate meat products infected with scrappy in the 1980s in Britain. Due to cows being infected, some people ate the brain and or spinal cord parts of said infected cow.
Some therapies to treat the symptoms include use of opioid painkillers.
Some common signs of mad cow disease in cows are head tossing, abnormal ear movement, teeth grinding, nose licking, tongue play, head rubbing/pressing, sneezing/snorting, increased salivation, and yawning. Like I said earlier, this disease is 100% fatal. There is no working treatment, and sadly, there is no way to slow the progression of the disease.
Since 1995, the FDA has banned BSE exposed cattle, provided surveillance on herds with mad cow disease. They prohibit feeding infected meat to cattle as well. They also ensure that no meat from high-risk cattle enter the food supply. Thankfully, the FDA is looking out for us. Stay classy, Sammamish.